dedoc. Welcome to Doc Day and welcome to dedoc's first ever dedoc symposium at ISPAD. My name is Bastian Haug. I am the founder of dedoc. I'm also a board member of the German Diabetes Association, Diabetes.de, and I'm on the board of IDF Europe and a few patient advisory committees, but today I'm here as the founder of dedoc. And dedoc, if you have never heard of us, dedoc is an international network of diabetes patient advocates. We started about a decade ago in Germany as a proper peer support group. And by the way, we can kill those slides, those come in later. The Doc Night is something I want to alert you all to already. dedoc.org/Doc Night is an event we'll be hosting on Saturday night if you want to join us. But for now, we're here at the dedoc symposium entitled What We Wish You, meaning the ISPAD audience, what we wish you knew and why. A big shout out also to our dedoc community, the community of people living with diabetes out there who are joining us through Facebook Live and through our website, who are not members of ISPAD, who are not here in the conference. We do have special permission to stream outside of the ISPAD venue as well. So I'm addressing the ISPAD audience here, but also everybody following us live through Facebook and through our live stream. So as I said, dedoc is a community of international diabetes patient advocates. We started 10 years ago in Germany, then very quickly over time became more and more international, and in 2015 started Doc Day, which is what we're hosting at every larger diabetes conference these days. We're hosting a Doc Day at ATTD, we're hosting a Doc Day at EASD since 2015 every year, and since 2 years now here at ISPAD. The first Doc Day in 2015 in Stockholm at EASD wasn't really a Doc Day inside the conference. We weren't allowed in. It was a Doc Day in a small co-working place that we rented outside of the conference venue. And it's a story I like to tell because it shows how far we have come, because as I said in the beginning, this is our first ever dedoc symposium where we're actually inside not only a conference venue, we're all virtual these days, but also part of the official program. Doc Day is a platform for the patient voice. Basically, what we're doing with Doc Day and have been doing for a number of years now is we try to turn the direction 180 degrees under the mantra, nothing about us without us. We want to take this hour to talk about what matters to people living with diabetes, what we believe is relevant, and we turn it 180 degrees around. And we are very happy that now at this ISPAD symposium, the official ISPAD audience is listening. We also started the dedoc Voices Scholarship Program 2-3 years ago. It is a scholarship program for diabetes advocates to join conferences like ATTD, EASD, and ISPAD. And there's a number of dedoc voices virtually present at ISPAD right now. Big shout out to everyone. What they do is they are invited by ISPAD. They are here supported by ISPAD and dedoc. And what they do is they listen in to all the great scientific symposia, industry symposia, etc. Then they translate both into different languages because they're virtually from all over the world, but they also translate into what they believe is relevant for their community of people living with diabetes out there. And then they pay it forward. They pay it forward by writing on Instagram, on Twitter, on Facebook, on their blogs, so that many people not registered here living with diabetes can get the key messages. Big thank you as a shout out to all of them. And those of you watching through Facebook Live, you will see a small reference to you in the back. It's the pink swan. The dedoc voices will know what that stands for. Now, today at ISPAD, as I said, first ever dedoc symposium, we will be talking about some of the topics that have been key to dedoc and Doc Day ever since we started. We're also going to announce a great collaboration that dedoc has recently set up with the BMJ, and Emma Doble, who's the patient editor at the BMJ and a former dedoc voice alumna, will introduce that. And we'll be talking language matters, peer support, access to diabetes care in the global south. These are some of the topics that are present at dedoc and Doc Day all the time. Before we do that, it is my great honor to welcome Kareem Before. You all know her, president of ISPAD, for her words of welcome to you, to us, to the dedoc voices. Kareem, thank you for joining us.
Bastian and dedoc community, thank you very much for being here. for coming with a very interesting title, which I, either or not on purpose, changed a little bit. What we wish we knew and why, because I think the topics you're addressing and the presence of diabetes advocates in our society as well as in our meeting is extremely important. So welcome for bridging as well these distances online, not only at the meeting, but as well afterwards and before. Great title, great topic. And I think it speaks volumes. It reinforces the importance of including the persons with diabetes, with the chronic condition in not only the meeting, but as I mentioned already, in far more. Little bit about diabetes, about ISPAD, because of course we think that it's a nice and a very good scientific society. And already there, I think the focus within diabetes care, and that has been promoted by ISPAD since its inception as ISGD, is they've got multidisciplinary teams. And that means that you do need to have persons with diabetes as well in the team. Membership for advocates. And that already is in our association articles of association. One of the most important achievements of and assets of ISPAD are their clinical practice guidelines. How can you make state-of-the-art guidelines if you do not include persons with diabetes, which is the case in the editorial board? And now as well at the annual meeting and the program. And we are not against any law, because we are not the first ones finally to have initiated that. WHO has published this year its WHO Global Diabetes Impact, reinforcing the importance that we have to address what is happening around the globe with type 1 diabetes. And there again, you need to have the person who has diabetes in this consultation. And he is in the paper explaining as well the value of that co-creation between WHO and those affected by the condition. European Medicine Agency and the FDA both have published already quite some time ago and are including in the decisions, or at least requesting advice on what is important for different conditions to be included when you look for a new drug. Drug development cannot not be done, I think, anymore if you don't know what you need to improve and how important specific improvements are for the persons who are living with that disease. So inclusion of patients in our decision taken and having a representation of the patient population in our committees has become a fixed person. Research projects, some of where I'm a bit more aware of, like Nodia Suite, we all have our patient advisory board and think that they play an essential role. And certainly for Enodia, they've done a great job recently as well with all the documentation and information, again, they're giving on that research. And then maybe the most important for me as clinician, no, not the most important, sorry, I'm definitely not the most important, but as a person, I can say that I think from the beginning of my career, I would have liked to know more and understand better. And that's where it's coming then, what we wish we knew and what we know we should know. Because working isolated as a doctor and thinking that you know all is from the past. I think it's essential to work daily life and whether in research or whether in clinic, that you know what's going on in the life of the person you're working with. And that makes diabetes treatment and care, I think, far more efficacious. If you understand what daily life worries, anxieties, fun, etc. are, then you can address the other problems just as much. So my question to you all is, there are so many hours in a year, you spend some time with the team. How much time do you spend on training the diabetes team and those you're working with in order for them to know that we know what you want us to know? Thank you very much. I wish you a great symposium. The topics and the speakers are very relevant, I think. And I think for the ISPAD community, it's something we are enjoying to attend. Thank you.
Kareem, thank you very much. First of all, thank you very much for having us here. Last year was the first time we had a doc day next to ISPAD, also on your invitation. This year is the first year we're actually having a dedoc symposium, and this is largely thanks to you, thanks to Jamie Wood, thanks to others in the background who've been working on this. Thank you very much. Thank you also for joining us live and for talking about the importance of the patient voice, not only for you personally, for ISPAD, but in general for research and for HCPs, for everyone basically out there. It is exactly what we try to do and try to promote with what we do in our daily work with advocacy, and specifically with the dedoc Voices program. The guiding line we have there is we believe in the value these diabetes patient advocates bring to this kind of conference. But more importantly, in general, we believe in this nothing about us without us principle, which is kind of our mantra. Now, as part of our work to strengthen the importance, to strengthen the patient voice in general, we have just started a very cool new collaboration, a collaboration with the BMJ. And we are very, very proud of this. And instead of me talking about it, I now invite Emma Doble, the patient editor at the BMJ, who is also a former dedoc Voice alumna, to tell us what this is all about. Emma, thank you for joining.
Thank you, Bastian, so much. And it's absolutely amazing to be here. And I'm so excited to hear all of our speakers as well today. So thank you all for joining us. So yeah, as Bastian said, I was diagnosed with type 1 diabetes when I was 4 years old. And I first joined the dedoc Voices for my first conference earlier on this year at ATDD. And I'm also one of the patient editors at the BMJ, and people often, the first question is, well, what does that mean? So in my role, I spend my time working with the BMJ to help them identify and work with patients across all aspects of their work. And that's something that they've been committed to since 2014. And the reason that they do that is that the BMJ really believes that patients should be treated and including as partners in all elements of healthcare. So that's from individual consultations and decision-making all the way through to service design and delivery. And at the BMJ, we do this by conducting patient peer review on all of our research. We encourage patient co-authorship on all of our content, and we ask our authors to complete a statement on how they've involved patients in their work. And we're currently rolling this out across all of our 70 other journals. So this is really important for us, and involving patients and partnering with them is really important. And I just want to pick up on that word partnership, because for us, that's the most important word, because we believe that patients are so much more than just their story, just turning up and talking about how hard diabetes is. Patients bring so much more unique insights. They bring ideas, they bring experience, they bring skills, and all of those things, really can help ensure that healthcare research, design, implementation are relevant, useful, and accurate. And that it's that belief that kind of brings us today to this collaboration with dedoc Voices. So at my first ever conference with dedoc, I was absolutely amazed and so impressed by all of the work that all of the dedoc Voices are doing. And I felt like this was such an amazing group who really had so much to add to healthcare. And using the kind of phrase of pay it forward, I thought, well, how can I bring this to a bigger audience to show what the patients can do and the patient community can bring to healthcare? So with Bastian, Hannah, and the rest of the dedoc Voices, we've really started thinking about how do we promote the work that they're doing. And that's where we've come to now. We are now welcoming patient articles from all of our dedoc Voices, and they will be published in the BMJ, and they'll be promoted across all of our content. And we're really excited to hear from our dedoc Voices, to hear about what they're working on, and to share all of these amazing and unique insights, ideas, and powerful testimony that I think the healthcare community can learn so much from. So I really hope that this collaboration really showcases how opening the door for healthcare professionals and researchers to welcome people living with diabetes, to partner with them, not just listening to their stories, but to really truly work with them in collaboration. We'll show you how to do this in a way that's really useful, meaningful, and that helps us all make the diabetes community and the diabetes world a better place for everyone. So I hope today that our speakers will give you a little insight into what this amazing community is doing and what they bring to the table. And I am certainly so excited to hear about their work and to hear from all of you in this session. So thank you so much, Bastian. And we're looking forward to hearing from you all very soon. I think you're still muted, Bastian.
Sorry. That happens. Thank you very much, Emma. I think we have to thank you personally and of course the BMJ for giving us and giving the dedoc Voices this big platform, because the BMJ is of course a global brand. And for this group of more than 100 alumni now to be able to do group authorship articles, being helped also by your editors to do this in the proper way is huge for us, and hopefully, as you said, also good for the BMJ and especially its readers. I can also say that we have the first draft article in already, and it's quite interesting because it's written by a group of type 2s, MODIs, and LADAs, and they write about the centennial, and the title is "Why Are We Not Invited to the Party?" The party meaning the centennial of insulin, because everything seems to be about type 1, whereas we all know that there's more people on other types of diabetes on insulin out there, and they feel left out. A very interesting take, soon to be found in the BMJ under the hashtag dedoc Voices. Thank you very much, Emma. Thank you to the BMJ. We've talked a lot about dedoc and doc day. This is a dedoc symposium, and it was really, really difficult for us to decide what to bring to ISPAD in what we have left now, which is about half an hour plus some questions from you. I would love to encourage everyone on the ISPAD platform and on Facebook and our live stream to please come forward with questions and comments. We're getting some in right now already. So it was very hard for us to decide which topics to present. Usually Doc Day is super diverse. We have 5 minutes per speaker coming from all over the world. If you have never seen a doc day, if you've never experienced this, patient voices coming from all over Europe, from Latin America, from Africa, from India, from Pakistan, from South Korea, please go to our website, dedoc.org, click on doc day and revisit the last one we just had 3 weeks ago, for example, at EASD, or the one from before, parallel to ATTD. It is truly amazing. For now, for today, for this symposium, as I said in the beginning, we decided to focus on 3 topics rather that were super central. And we'll start with the first one. Language matters has always been something we have been very vocal about at Doc Day from the very, very start since 2015. And one of the protagonists, of course, who has brought this whole topic, language matters, to our own DDoC's attention, but also to the community out there, is Renza Shibelia from Australia. Renza, thank you very much for joining us, and we all look forward to your short presentation on language matters and why it's so important.
Oh, Bastian, thank you so much. I'm absolutely thrilled to be here as part of the first DDoc, or Doc Day, I should say, symposium at ISPAD. And I'm thrilled to be talking about language matters. So my name is Renza Shibelia. I am in Melbourne, Australia. It's 3:49 a.m. right now, so I do apologise for what very much sounds like my morning voice. But I am very happy to be here regardless of the time. And I'm thrilled to be talking about language because it is something that I hold very dear to my heart, and I'm very happy, I guess, that it is something that we speak about in the diabetes community. That there is a movement, because we love a hashtag, and the hashtag is language matters. And if you were to pop that into Twitter, you would see hundreds and thousands of tweets from people in the community talking about language. It's not just about the words we use, though. It's bigger than that. It's about communication. So it also includes the images that we use. It also includes the tone that we use. And the whole point, I guess, behind the Language Matters movement was to really look at and improve the way that we speak about and to people with diabetes. The bottom line is diabetes has an image problem. If you look at the way that diabetes is spoken about in the general community, so not necessarily by people who are involved in diabetes. Diabetes jokes are absolutely fine. Every comedian has a diabetes joke in their bag that they like to bring out. You will see at, for example, on TV cooking shows, of which there are many, a beautiful, delectable dessert will be referred to as diabetes on a plate. We hear people saying to us, should you be eating that? People ask us if we need to be doing our diabetes chores. So, you know, anything that we need to manage our diabetes, they ask us if we need to do that. Can you go do that in the bathroom? That's just in the general public. But even within our own diabetes community, we see that diabetes is spoken about in ways that really do stigmatize us, blame and shame us, and make us feel judged. So what are some of those words? Well, the big C word in diabetes for me is compliant, compliance, non-compliance. I know that begins with an N, non-compliant. They're words that have so much judgment built into them. So when we hear that we are being non-compliant, it sounds like we're being willful toddlers who aren't following instructions, when diabetes is all about us managing our condition. I've lived with type 1 diabetes for 23 years now, and I have a truly remarkable diabetes healthcare team around me to support me. But I get about 4 hours a year face-to-face time with them, or Zoom-to-Zoom time with them, I guess, these days. That's not very much. The rest of the time I'm managing this on my own. So to be called non-compliant and told that, that judgment, that's really difficult when this is something that we're doing on our own. You'll notice that one of the things that I haven't mentioned so far is the words that the people with diabetes use, whether it be to describe ourselves or to describe our condition, because that's actually not really what Language Matters is all about. I refer to myself as a person with diabetes. Other people refer to themselves as diabetic. There is no right or wrong. As people living with this condition, we can speak about it in any way that makes sense to us. So how did this movement start? Well, it started very much within the diabetes community. It was people with diabetes acknowledging that language matters, that language really does have power to make us feel that we can manage our diabetes, or make us feel really judged and like we want to hide away from it. Diabetes Australia, where I work, launched the first language position statement for diabetes 10 years ago. And we're super proud of that. But what we're most proud about is that it was embraced by the community, and that other places have also picked up the idea of needing some sort of guiding document that provides information about why language matters. We see research about it now. We've got a better understanding about how we can use words to empower people, and how it really is important to be mindful of what we're saying. I'm actually speaking in one of the sessions at ISPAD. In fact, after Doc Day today, I'm speaking more about the issues of language matters. And so if you are around, I really hope that you're able to join me for that session. There is some great research in this area, and I would really encourage you to have a look at that, because I think that what that has done has really helped reinforce what it is that people with diabetes have been saying. The wonderful Professor Jane Spate from the Australian Centre for Behavioural Research in Diabetes and I have a tag team routine that we do at conferences and at meetings, where I get up there and I talk about how language impacts me as a person with diabetes and what I hear from other people in the diabetes community. And Jane then talks about the research that really backs up what I'm saying, which is that language really does matter. I urge you to join us and to get on board with what it is that we're saying, and understand that it is understand what we're saying. Understand that there's no one size fits all. It's okay for people with diabetes to not think this really matters, and that they think that there are much bigger and more important issues to deal with. But I do say this, the image problem that diabetes has, because of the way that we have communicated about it, the way that others have communicated about it, means that diabetes gets less funding than other conditions. In Australia, our big national medical and health research program, diabetes research has dropped 30% in the last 10 years. it's not seen as being as serious and as important as other health conditions. People think that diabetes, we brought it on ourselves, and so they're less likely to reach into their pocket to make a donation to a diabetes charity. That's what using language that makes us feel blamed, that's how it forms the attitudes that other people have. So that's just what I wanted to touch on. It's a very brief discussion. Many people who are watching this from the diabetes community and the dedoc voices have heard me speak about this before. I'm not a one-trick pony. I do have some other tricks in my bag that I can talk about as well. But I'm thrilled that I've been invited here today to speak about language matters and in the next symposium as well. So I'll throw back to you, Bastian. Thank you.
Renza, thank you very much. And please stick around for the Q&A and the discussion later on if you can, because we're already getting some great comments both on Facebook and here in the chat. Everybody watching, please feel free to post comments to the speakers already now. We will collect them and then get back to that in the end. Renza, what I love about you is talking about language matters, and that's why we've had you over and over again at Doc Day, is that you give this broader context and explain so well that it's not only about the single word non-adherent or non-compliant or poorly controlled or whatever it may be, but the effects of it also in society at large and why that matters. Thank you very much. And we come to the next topic, which is kind of at the core of DDoc, at the core of Doc Day, and at the core of everyone who has been attending Doc Days in the past. You have to know that Doc Days in the past, of course, have been face-to-face. They have been at ATTD, EASD, or ISPAD. And what we would usually do, we would just gather everybody who was at the conference coming from a patient organization or from this diabetes online community, this wild Twitter or whatever community out there. And we would say, hey, if you have anything to present, just come forward, here's your stage. And then they would talk about what they do in their daily lives with advocacy, which was mostly rooted around peer support. And there's lots of papers around peer support. There's lots of research on why peer support matters. We wanted to give the stage to Steffi, one of our first kind of members in the German community of DDoc, to talk about how peer support matters to her, mattered from the very beginning until today. And when we asked her, she was a DDoc voice and a diabetes patient advocate. Just for disclaimer, Steffi, you have now also joined the DDoc team, but for now, you're talking as yourself, as Steffi, about peer support in the diabetes world. Steffi Haag.
Thanks so much, Bastian, for that introduction. And yeah, thank you so much for the opportunity to talk about one of my most favorite topics in the entire world, which is peer support in the diabetes world. A little bit about me. I have type 1 diabetes as well as a polyneuropathy. I'm based in Berlin, Germany. Yes, I do work for DDoc, but I'm also a patient advocate. And yeah, I thought it would be most interesting to dive into my own story with peer support because it's been a good one. So I was diagnosed, or rather I diagnosed myself via Google in 2009. And I realized, oh, these symptoms really do mean something. And I guess it's diabetes. But unfortunately, it took me ages until I researched diabetes online again, which meant for me that I was really isolated the first couple of years after my diagnosis. And I felt so frustrated because I was being told that managing my diabetes should be quite easy, which I didn't find to be true. And it took me years until in 2014, my then endocrinologist gave me a little flyer. And funnily enough, that's the one and only batch of flyers that Bastian ever printed for DDoc, but it worked. One of them reached me. And my doctor, he said, well, you're modern and digital. Maybe you should connect with these people in Berlin who meet online. And that was a revelation to me because I realized I was not the only person on the entire planet who lived with diabetes. And most importantly, I wasn't the only one struggling because diabetes is really hard. And yeah, that just changed everything for me. And that also led me to start my own blog and my own journey as an advocate a year later. And yeah, fast forward to 2021, I live with diabetes. All my passion projects revolve around diabetes. And now I work in diabetes as well. And I couldn't be happier about that, really. So just to illustrate that for the fans of the series Narcos, without peer support, I was really lonely, I was isolated, I was struggling. And with peer support, I'm still struggling with diabetes, to be honest, but I feel way less alone and much better equipped because I know I'm not in it alone. And that's exactly the reason why people seek out peer support. Renza put it down in hours, actually. I stuck to days here. There are 4 days a year that I see my endocrinologist. That's 1.1%. And the rest of the time, I'm completely on my own. So I still need support and connection, inspiration and motivation. That's why I seek peer support. I also want to find people to collaborate with on project ideas. And I also seek out information and education. And now, ideally, that would be education that just complements that I receive from healthcare providers. But in some cases, this does act as kind of a counterweight or something like a second opinion, if I'm really honest. But don't just take my word for it. I reached out to my own community on Instagram and asked them what peer support means to them. And I'm just going to give them a quick read here. It gives me so much motivation to be connected with people who are dealing with the same thing as me every day. There's always someone I can talk to who just gets it. They understand me without me having to give a whole lecture first. It makes a world's difference in challenging times, and it's also a lot of fun just for us, people with diabetes. It's getting help and perhaps helping others. I've received tons of useful tips for real life with diabetes. There are people who are there truly to listen. We have conversations on a level that just wouldn't be possible with others. And what I think sums it up perfectly, for most people, peer support is the thing they didn't know they needed when it comes to diabetes. I think that just sums it up perfectly. But let's look into what peer support can look like. Of course, it all originated in the real offline world, and that still exists. So there are still offline support groups, meetups. Here's a photo of one just last week in Berlin where we met up. There are also support hotlines. One example is in Germany. It's called Dia Engel. It's an actual hotline you can call and you can talk to people with diabetes who get it. And of course, there are community events and projects. There are countless diabetes camps for kids and grown-ups. And here at dedoc, of course, we run projects like our Christmas card snail mail project or Diversity, where we send out letters with blue circle pins to people on the day of their Diversity, which I think is an amazing way of connecting with them. But for me personally, my home when it comes to peer support is the online world. That means social media. So there are tons of platforms out there where we can connect with each other. There are also community forums, which may sound old school, but some of these are still really, really active and make a huge difference in people's lives. Of course, there are people who create content and provide that on their blogs, podcasts, videos. And there are patient networks and platforms such as dedoc who run events like Doc Day, which, as Bastian said, used to be offline, now is online. And of course, there are meetups, countless meetups. I've just included one that a friend of mine is running. It's a monthly worldwide meetup that everybody can join. And I think these are just some examples of what peer support can look like. I do want to be honest here, nothing's perfect, of course. As a German, I have to say this, there are questions of data security and privacy here as we're talking about health data, which is quite sensitive. And also, I want to be honest, we're not healthcare providers, so we should not give each other medical advice. And of course, there's also misinformation out there that we have to navigate somehow. Moreover, of course, there are people who behave badly online, offline in these groups. And it should be said that social media can always invoke feelings of inadequacy. If you look at perfect bodies all day long, that might lead you to feeling inadequate about your own body. And it's the same with blood sugars. If you only see perfect 100s and stable curves, that might make you feel bad about your own. That's why I personally think it's really important to always share the highs and the lows. And I feel in my community, most of the people do just that. And lastly, I do want to mention, I'm not sure, or rather I know that not everybody feels safe and welcome in these communities. So there is discrimination here regarding types of diabetes, but of course also regarding ethnical and racial backgrounds. And so I do want to say that we still need more diversity and more safe spaces for everyone here. But focusing on the positives, I thought I'd draw up some examples of what kind of content I seek out online. So these are just some Instagram posts that make me feel, oh yeah, I feel seen, I feel understood. Some of them are funny, some of them are clever, some of them just manage to put something into words that I and many others feel, but we couldn't quite express. So that's an incredible moment every time we see something like that. But most importantly, with peer support, it comes down to the people. And there are countless amazing people, for me, especially online, but for others offline, that we can connect with and that we can see each other in and see ourselves in. And I think that's incredibly powerful that there are people on there that we can resonate with and connect with. And of course, life with diabetes is no surprise. It's not always happy. There are some really tough times. And to me, it's incredibly powerful and helpful to see that we're all in this together. I'm including a post here that I sent out just after I got diagnosed with polyneuropathy, which was a tough blow, but the community really was there for me. And I think that's something that I wouldn't want to miss. And of course, with so many creative people out there, there are also artists who take their experiences with diabetes and express that in different ways that really is inspiring for everyone out there. And something that I think is really important to see is peer support is one thing, but it can actually generate other things and it can be taken to a different level. And I know for me, peer support is how I got into advocacy. And I know I'm not alone in that. So I think that's really powerful, but also in other ways, taking peer support to a new level. We live in imperfect healthcare systems. And although advocacy can lobby for real systemic change here, people often need support immediately. And that's where mutual aid comes in. So there are people out there who actively help each other. I wish it didn't have to be like this, but that's where we are. And I think this is just one way of peer support really changing people's lives and maybe saving it even. And lastly, of course, it's also a level of peer support when a group of people with diabetes really change the game when it comes to insulin delivery devices. So I think that's another example of peer support really making a huge impact. So to sum up, in my opinion, peer support is an integral part of the diabetes management of many people with diabetes out there, me definitely included. I'm certain that it's saving lives, it's improving medical outcomes, and it's definitely improving quality of life. And most certainly it's here to stay. So I hope you get on board. Thank you.
Steffi, thank you very much. And thank you for giving this word or hashtag peer support such a colorful and personal face and showing everyone out there what it means to you personally, but also to so many others that have benefited from it and that live through it. And yes, it's always nice to hear you make this so personal. I would once again like to encourage everyone to provide your comments, your feedback, your questions, either if you're an ISPAD participant here on the platform, we will come back to your comments and questions later. If you're watching us live, if you're watching live on the dedoc website, we are only monitoring the Facebook chat. So if you're going on the website, please go to our Facebook live stream, and there you can also ask questions, put your comments, and then we can go back to that in the open Q&A session. Steffi, one last comment. Thank you also for, I saw on your last post, you had a reference to the We Are Not Waiting community. It is one of the other topics we thought about including here today at the dedoc symposium, but because that has also been very central, the whole We Are Not Waiting, the open consortium doing research on closed loop and DIY solutions. We decided that this is also so heavily represented now at ISPAD itself that we'll rather focus on a different topic now. That's not to say that this is not a core topic at everything that dedoc does and that Doc Day is usually about. But as I said, Doc Day usually represents not what we think is important. We ask every diabetes advocate out there to please come forward, and it is their platform. Doc Day is a platform for others to stand on, and some talk about language, others like you now about peer support. And then there is others, because Doc Day has, through going virtual, it's one of the good things of the last 18 months and of the pandemic, it has always been limited kind of to the people present at a certain conference. Now, since the last 1.5 years, since going virtual, we've been able to include voices from all over the world because everything is virtual. And one of the voices that has really grown over the last 1.5 years, ever since first showing up here at dedoc at one of our networking events, is Dino Tenda from Zimbabwe. Dino, it is great to have you here. It is great to see how much you've been doing over the last 1.5 years since we've gotten to know you. And it's great to now have you talk about the topic that is closest to your heart. It is, of course, access to diabetes care, as you are from Zimbabwe, and you'll talk about it from a Zimbabwean, but also a larger African perspective. I hope the internet connection will be stable. We have a backup just in case, but let's see if this works. Tino from Zimbabwe.
Thank you for having me, and I'm internally grateful. Out of words, this topic is very, very close to me, and thank you for having me speak about it a little bit. So my presentation will focus on access to diabetes care in the way that I've presented it: the availability, affordability, diabetes education, healthcare, monitoring, and yes. So I'll move on. So if I have access to, I cannot slide. Okay, thank you. So the introduction, first and foremost, 1 in 2 cannot afford or cannot access insulin in the whole world. And around the globe today, people living with type 1 diabetes are dying because they cannot afford to get hold of insulin, to get the supplies they need, the education that they need, they cannot get it, and the treatment that they need is very, very critical to get. And in Zimbabwe, diabetes care is rapidly becoming a major public health issue, and in many other countries in Africa, especially in the low to middle income countries. Diabetes education is rarely talked about in Africa. Professional advice is not really a priority, considering the cost that one has to pay for consultation to a doctor. And treatment was compromised during the COVID-19 pandemic. So it was very, very critical. And moving on to availability, there's an inverse relationship in the sense that the supply has improved over the years in Zimbabwe, but access still remains an issue that has not been fully addressed. And insulin is, however, readily available in the urban areas, but however, in the less remote areas, people are always found wanting. They would have to embark on 200 to 400 kilometers in the hope to find the insulin that they need. And therefore, patients would have to resort from the modern insulins to the old insulin regimens because they're living in the rural areas. They cannot really afford the modern insulin that they need. Now moving on to affordability. So insulin prices have varied from private to public and from human insulin to analog, meaning to say analog insulin is very expensive and getting insulin from the private sector is very, very expensive. And at times people would have to walk back home without the insulin that they would have wanted to get. So analog insulin is twice the price of human insulin, because it is mostly supplied in insulin pens that you can use only maybe for a week, and you still need more money to get another pen of insulin. And those people living with diabetes, they prefer the human or the premix, the vials, even if the professional advice is against it, because the analogs produced have much greater potence that people can have a good quality life. And mostly the adults in Zimbabwe or in any country in Africa, they are usually rationing their insulin because they are no longer working. They do not have anyone to cater for their dosages that they would need. So they would have to ration, maybe at least injecting once a day, maybe in the morning, and then in the evening, they will not have to inject themselves. And families now have accepted to let their afflicted or their members to go for days without a dosage. In the case that they do not have money, they'll just feel okay to say, okay, fine, maybe next week we'll have the money to get the insulin that you need. And more so, it has become a norm from switching from insulin regimens to metformin. For people living with type 1 diabetes, we have had cases where children were switching from insulin to use metformin, which is a drug that is used by type 2 diabetic, which I hope everyone watching this knows this. So this is really the thing, and that is our status quo in Africa. And moving on now to diabetes education, which is very, very critical no matter what, no matter where you are. So diabetes education is too far from optional. People are not fully aware about diabetes or the complications that comes with it. And so in Africa, it is the region with the highest proportion of undiagnosed diabetes, meaning to say 60% of adults are currently living with diabetes, but they're unaware. And this is in accordance to the IDF statistics of 2019. So everyone should be able to understand his or her condition, including adjusting the insulin dosages and the diet. So therefore, we cannot really talk about DKA, diabetic ketoacidosis, which an ordinary person in the less remote areas has never heard about, but they're always found on the verge. It's either they're getting into DKA or they are getting out of DKA, mostly in hospitals anyway. And now moving on to healthcare, what does this mean? So everyone should have a hospital care in case of emergencies and ongoing specialist care from a professional who understands type 1 diabetes. So healthcare was compromised due to COVID-19 restrictions, and I'll sum up how this has been. So you had to have an emergency for you to be able to see a doctor. It's either you would have come to the hospital in an ambulance for the doctor to attend to you. Otherwise, it would be the ordinary nurses, the general nurses that do not really know what diabetes really is. And secondly, doctors are now accepting their patients' plea to switching from medication without highlighting the implications. For example, switching from insulin to metformin. And now doctors are even allowing it in Zimbabwe. And now proper medical advice is readily accessible, is mostly accessible in the private sector, but however, the cost is so absurd, so people cannot really get the help that they need. Now, in monitoring of blood glucose, so everyone should be able to test his or her blood sugar regularly for a greater quality life. And there's always been an issue of opportunity cost in relation to insulin and diabetes supplies. So people now have to say, okay, fine, I can only afford insulin. If I'm barely affording insulin, so can I really talk about glucometer? Can I really talk about test strips? No, can I talk about ketone test strips or the syringes themselves? Because now it's a really critical thing. So people just have to say, okay, fine, I'll just stick to insulin. And what about the rest later? So people in Africa are making critical choices because of that. And whether insulin or diabetes supplies, in the case of people living with diabetes, and at times they are even foregoing insulin. They would have to forego the diabetes supplies in the hope to get the insulin to inject themselves the insulin that they need. And millions are not aware of HbA1c, but the diabetes online community now have started talking about time in range. So people do not know what this is because we are yet there. Even if right now they do not know much about HbA1c, the things that are already there, the CGMs, we cannot really talk about them. The pumps, for one to have an access to a pump in Zimbabwe, it's either you are in a DKA or maybe during your diagnosis, when you go to the hospital, that's when you would have to be attended with the insulin pump. Otherwise, nobody can afford an insulin pump and nobody is using it anyway. So however we appreciate, we are grateful for the supplies that we get. Firstly, children up to age 18 from Uganda benefit from the Changing Diabetes program by Novo Nordisk, and children in Zimbabwe, 25 years and below, do get, who are also members of the Zimbabwe Diabetic Association, they get the insulin and they get the insulin, the diabetes supplies that they need so that they can cater for themselves. And recently, due to the help from the Direct Relief and the Life for a Child, even adults are now getting the type 2 diabetic medication, the BP tablets that they were not able to afford then. And however, in Botswana, healthcare is absolutely free. Everything is free. You get it for free. Whether it's diabetes supplies, HIV supplies, whatsoever you need, you get it for free in Botswana. And now the associations, they will now have to focus on diabetes education. And mostly they conduct educational webinars because they cannot really be talking about advocacy of insulin supplies because everyone is getting it anyway. So their quality of life is hence improved and they are having a good life. So, and as the diabetes online community, what is the message that we'd like to bring to you? So we would only feel relieved when we know that we can access the next vial or the next pen that I need. We would only feel confident or safe when we know that the ones that we are to depend with, especially the healthcare professionals, really know what they are talking about. They really know what diabetes really is. And we know the world would become a better place if only insulin for all becomes a reality. And with that, I say thank you and unite for diabetes. Thank you.
Tino, thank you very much. I think it is really important to have voices like you, because very often, nothing about us without us. Very often we're here in the Western world talk about insulin access to diabetes care. It is the global topic of this year's Centennial and World Diabetes Day. But I think it is so important to have people like you from Africa. And we'll have another Doc Day on World Diabetes Day dedicated specifically to the topic, where we'll have other dedoc voices and advocates from all across Africa, from India, from Pakistan, from Latin America, talk and present their personal stories and how they live through the realities on the ground. We had Jeremiah from Liberia join us on one of the talks recently, which was also amazing to hear his very personal struggle with accessing the basics, not just insulin, but the basics of healthcare in his country. And I think that is really important to hear here. Now, again, I would like to encourage everybody listening to post their comments, their questions, anything they would like to address to the three speakers, to Renza on Language Matters, to Steffi on peer support and her lived experience, and of course to Tino on access to diabetes care. And Kareem, as I see you are still here, I thought you would only join us for the first couple of minutes, but as you're still here, and I do see that you actually posted 3 questions in the chat, although we hadn't foreseen that, but do you want to ask those live maybe?
I think it's far too fascinating to hear. And I indeed have some questions, if I may. Very impressed by all the presentations. First question is not written yet. Renza, how do you think we should approach it in the medical training? Luxembourg starting its university with a Bachelor of Medicine. How should we teach our students to improve the language they are using?
Oh, Kareem, that is such a brilliant question, because that's part of the thing, is how do we catch health professionals early? And part of that is to, I guess, undo some of those preconceived ideas and misconceptions that they might have about diabetes. So I'm involved actually in a couple of different programs around that. One of them is that I speak to first-year med students in their orientation week. It's literally their first week. They're not even baby doctors yet. They're baby students almost. And one of the things we talk about is this. We talk about great experiences, because I think that it's really important that we highlight this is how it's done well, rather than just focusing on the negative, because there are brilliant, wonderful examples, but also there are terrific resources out there that I would use. So we're, these language position statements, and there are now probably close to 10 of them around the world. I would use those. Often they are written by diabetes organisations. In the UK, in England, it's NHS England. It's an NHS England document. There's one in France. There's heaps of them. So using what is there as a good guide is a great place to start, and just asking people to be mindful and align perhaps with I guess the philosophy of what is in these statements. But this is such a great question, because it is about this reframing what we think about diabetes, and let's start that as early as we possibly can.
And get them as well to consider, as one of the papers of ISPAD showed, medical students at their end of their training very often are not really well aware of what's happening with diabetes and what diabetes means. And yes. Stephanie, if I may do a quick second one, Bastian.
Go ahead, quick.
That's for Stephanie. Great talk, and I think very important. But being a pediatrician, how to deal with language differences and how to deal. Have you ever come across, that's always, well, maybe I'm worrying too much, bullying over internet. We've had some very nasty cases, I know, over the last 10 years, not associated with disease, but with internet bullying. And how can we prevent that? Have you got controls or not controls, but how would you see that?
Thank you, Kareem. Very important question. Yeah, like I said, it is a problem. There are people, especially online, who do behave badly and who are not in it for the greater good, let's say, but for either their personal gain or their personal amusement. And it's hard to say, like, if you're talking about specific closed forums, those have rules and those have administrators. Same goes for example, Facebook groups. But a lot of these places where people meet online are unregulated, which is sometimes a good thing and sometimes a bad thing. And I encourage kids and also parents of kids with diabetes to connect online, but also to have a close look at who they're talking to and what's really happening. And yeah, we do need to protect each other from time to time on there as well. Yeah, definitely.
And if I can add on to this, one of the experiences we have in the dedoc communities, which in the initial stages was very much Twitter-based and now has moved to other forums such as Facebook and Insta, etc., is that it's very much self-policing. So because it's so big, because it's so fast, if you follow the hashtag dedoc, especially during conference times like these, one person making a wrong or a bullying or a somewhat controversial statement will be basically jumped upon by this larger community where most of the people really mean good because we're all in this together. And it's self-policing or self-controlled in a way in that many people will correct or contradict if there's something like what you would call fake news or bullying in its worst form. Now, there's a lot of comments in the chat that are just, you know, supportive of what Renza said about language matters. Steffi, what you said about peer support. There's also a question by Dr. Mark about children in dedoc, and I'll just quickly answer that. Dedoc doesn't, you know, it's a hashtag. Everybody can use a hashtag. Everybody can join. We don't do a children's program here at dedoc, but what we do is one project in Germany that we hope to scale out to other countries very, very soon. It's called Diversary. It's a project where we give the small blue circle pin to people with diabetes on the jubilee of their diabetes diagnosis. And there actually we have a lot of children with diabetes that probably have been signed up by their parents, but that is also something we do. Going back to questions, there's one coming in through the Facebook chat. It's product specific, but not directly. I'll ask it in a more clean way here. But Tino, can you tell me something? I think this is more about type 2 maybe, but in Zimbabwe, what's the use of insulin versus metformin in your country? Is that something you can talk about? I'm not sure that's...
Okay, so if I understood your question correctly, I don't know. Okay, so the use of insulin, as we know, metformin is for people that are living with type 2 to increase the sensitivity of your insulin for people that are living with type 2. But now that insulin is very much expensive, especially the modern or the analog insulin, people are now even vying to say, okay, fine, what if I try to use metformin? Because they're not really aware if they switch to say, okay, is the use of insulin the same as the use of metformin? Them not knowing and the healthcare professionals not knowing correctly, they'll just say, okay, fine, I think we can just prescribe you what you want.
Yeah. It's
not knowing that it's not by choice, but it's really crucial that someone living with type 1 should inject insulin. So, but mostly many people in Africa, I mean in Zimbabwe, they are type 2 and less people are type 1. So yeah.
Okay. Emma, I have a question for you. You just talked about this collaboration, dedoc and the BMJ. I would actually be curious from your perspective as the patient editor of the BMJ, bringing these kind of voices as we hear here, plus the more topics that we usually address at a doc day to the BMJ. What do you think the typical readership of the BMJ would have as a potential question on the 3 topics we were discussing now: peer support, language matters, and of course, the overarching access to insulin, especially right now, or access to diabetes care?
Yeah, definitely. I think this is these 3 topics are all of huge importance, and I think they're all things that our readers would be, really interested in, and I'm sure many of them would be keen to ask lots of questions. But I'm going to work through the 3 of you, if that's okay, one by one. So Renza, I think often healthcare professionals can read about language matters, and maybe they've heard come and listen to your kind of talk today. But I think what they want to know is, when they go in tomorrow to see a patient, what can they do and straight away act upon right now to make sure that they're using the language that is supportive and understanding for that patient in front of them?
Oh, ask them. I know that sounds just so basic, but it kind of that is. So that can actually be from, how would you like me to refer to you? It can be, taking cues from the person is really useful, and saying, look, if I say something that upsets you, please let me know, because it's not intentional. I genuinely believe it's very rarely intentional. It's not intentional. It's not meant to be malicious. Please, let's have an open dialogue about that. My endocrinologist actually was one of the co-authors on that first language position statement. So she's so switched on with this, but she still catches herself sometimes. And I always say, it's fine. Like, I would never jump on somebody. I'm just so appreciative that it is front of people's minds. So ask, have an open conversation about it. It's a really good way to start.
Completely. Could not agree more. I think having that open dialogue is hugely important for all of these topics, isn't it? And Steffi, in terms of peer support, I think a lot of healthcare professionals can be really nervous about sending, sort of directing patients off to other patients. What are they going to tell them? Are they going to give them the wrong information? So what would you say to kind of health professionals who are maybe a bit nervous about recommending or sort of advocating for peer support to their own patients?
That's a great question, actually. I would say, if a healthcare provider signals very clearly that they're here for their patients and are willing to support them with, if they have specific medical questions, then there isn't a need to turn to the community for medical issues as such. And then you can really focus on the lived experience and like little tricks. And if the healthcare provider, again, if they're open and in contact with the patient, then you can also go back and forth and maybe bounce off ideas of each other. So I think it's important that when you seek out the community, you know what you're looking for. And ideally, you wouldn't be looking for medical advice in the first place. But either way, you will encounter medical advice. I think that's pretty hard to avoid. So it's important that you know how to navigate that, and you have a healthcare provider that you can turn to when there are any questions, or if you're unsure about something. But really, for me, it's the emotional side of things. It's the day-to-day ways of dealing with diabetes that the community is really, really valuable for.
Amazing, thank you. And Bastian, if I have a couple of minutes, I'd love to ask Tino a question.
Sure, go ahead.
Thank you. So Tino, I think your presentation is hugely inspiring and really powerful to listen to. And I think many of the BMJ readers would be listening to you thinking, what can I do as a healthcare provider, as a healthcare professional? What should we be doing as a community in the diabetes world to improve access of insulin and to improve education and accessibility of education for people like you?
Oh, great question. So my motto would be, let's come up together. Let's engage, let's get engaged as a community and demand the change that we need. Education, because right now, because insulin is not readily available, any other supplies are not readily available, people now spend time speaking about those things, demanding those things, and not focusing and neglecting education. So if we do come up together, uniting for diabetes, I think we would achieve. Yeah, so basically that's it.
I love it. I think all three of you touched upon that powerfulness of partnership across our whole community, which I think is absolutely amazing. Thank you all so much.
Thank you also from my side. Thank you, Emma, for these questions. We're already a bit over time, so I'm afraid I will have to close it here. But this talk will stay online on our YouTube channel, which you're always welcome to watch. Also to hear more about dedoc and doc day. All the previous doc days that have been virtual are recorded and can still be accessed there. Many patient voices from all over the world. The next doc day will be on World Diabetes Day. together with IDF Europe, again, focused specifically on how we celebrate World Diabetes Day in this centennial year, but also with a special focus on the access topic with patient advocates from India, Pakistan, Latin America, and from Africa, of course. So maybe Tino will see you there again as well. Life for a Child will be present, JDRF will be present, and some other partners too. With that, there's one more thing I could invite you to, which I mentioned at the beginning, Doc Night on Saturday. Again, on our website, dedoc.org/Doc Night, you can find an access. This is where you can meet all the dedoc voices and patient advocates that have been working with us over the years. You can have one-on-one conversations there. We go to a very special place called Kumu. We have a virtual bar, virtual drinks. You can jump into a pool, sit on a sofa, talk in small groups, big groups, or one-on-one. Tino, I hope you'll be there. Renza, I know timing is terrible for Australia, but maybe you and some of your friends from the other end of the world will be there. Join us for Doc Night this Saturday at 7 p.m. European time. That's pretty much this time right now, all over the world. Would be great to see you there. With this, I hope you enjoyed our first ever dedoc symposium here at ISPAD. Kareem, again, you and your team, thank you very much for having us here for the first time ever inside a real international conference with Doc Day on the program. And any questions, just get in touch. We always love to hear from you, and we love to bring the patient voice closer to these conferences, to HCPs, to industry and researchers all over the world. This was DDoc, this was Doc Day and the DDoc Symposium at ISPAD. Thank you very much. Bye-bye.